of all, thank you for having me here. I come here today as a mother with a son who has Crohn's disease. My husband has a pre-existing condition, and my 85-year-old mother, she lives with me. And you know what I've discovered? The hospital. I come to this from an unusual background, and when I was in the hospital with my son, he was screaming in pain, and I was looking at the emergency room. No one was coming. It was 3 in the morning, and what I remember was from my background, I started in GE, leading teams to design parts of aircraft engines. In my background, I used to lose sleep because we would make the slightest little change to a part of an engine, and I would worry that the plane could crash. Here I was in a hospital. My son had just urinated blood, and no one came. So when my son was in the hospital, and I had nothing to do, I don't do well with nothing to do. I started looking around, I'm like, well, what can I do? I mean, I was giving him the ice chips, but I said, I think I can figure out how to help. And I started just writing everything down, and just keeping a journal with the intent of today, with the intent. I mean, this is what you have moments in your life. Thank you for being part of my moment. Because my moment was, how do I help other people improve the system? Our mission is to make Connecticut a center of excellence. I will share with you, if I had numbers in GE that were in the 60s, 70s, and 80s, I would have been fired. Now, there are people sitting here right now and they're saying, no, Randy, you can't compare healthcare to a business. But here's what I'm going to tell you. The game has changed for your patients or your customers. Here's what has happened. They are getting this information, and even bigger than that, the money is coming out of their pocket right now. And when the money comes out of their pocket, they're asking more questions. We had, unbelievable, but my son's Crohn's had progressed. The doctor comes in and he says, okay, actually he flew it, let me describe it. He flies into the room, it progressed. Let me tell you, you have a couple of options here. There's Remicade, and he hands me a piece of paper. It was 5 sheets thick. Right on the top it said possible lymphoma risk. I don't think I looked at the other pieces of paper, and I don't think I really was even hearing anything. He said we can do 6MP, he mentioned something else, and he goes, and there's a nutritional approach. And then he can see, he saw, I looked like overwhelmed. Like, what's this? And then he had to go. And he said, we don't have to decide this right now. And he left. We have to find a way to engage them, but also be able to show them that compassion.